Welcome to HIPAA compliance training for the North Carolina State Medical Response System. Whether you are deployed to a mobile disaster hospital, a state medical support shelter, a community care site, or on an ambulance, protecting patient privacy is part of your mission.
The Health Insurance Portability and Accountability Act of 1996 is a federal law that protects the privacy and security of individuals' protected health information, also known as PHI.
The Health Insurance Portability and Accountability Act applies to many types of organizations that handle patient information. This includes hospitals, clinics, billing services, insurance companies, Medicaid, and business associates like private vendors or third-party administrators who work with healthcare providers.
PHI includes anything that can identify a patient: names, diagnoses, social security numbers, and medical histories. If you are entering records, responding to a call, or reviewing charts, you are handling PHI. Keep PHI confidential and secure, whether written, spoken, or electronic. Never share PHI with unauthorized individuals. Use passwords, encrypted devices, and lock screens when stepping away.
The Health Insurance Portability and Accountability Act outlines 3 categories of safeguards to protect patient information. Administrative safeguards involve policies and procedures to manage security measures. These include regular staff training, ongoing risk analysis, and clearly defined access controls. Physical safeguards protect the physical environment and equipment where PHI is stored or accessed. Examples include restricting facility access, securing workstations, and ensuring proper disposal of sensitive information. Technical safeguards involve the technology used to protect electronic PHI, ePHI. This includes the use of secure passwords, encryption, and audit controls to monitor access and activity. Risk analysis is not a one-time task. It must be continuous to keep up with changing threats and environments. A Health Insurance Portability and Accountability Act violation can lead to a range of consequences depending on the severity of the incident. Technical assistance provided to help organizations meet compliance requirements. Investigations or compliance reviews conducted by the Office for Civil Rights, OCR, to assess violations. Corrective action plans, required changes to policies, training, or safeguards to address identified issues. Wall of shame and negative media. Exposure, public posting of large breaches affecting 500+ individuals, harming your organization's reputation. Fines, financial penalties that can range from hundreds to millions of dollars. Criminal investigations, in cases involving deliberate misuse or theft of patient information. Important, breaches affecting 500 or more individuals must be reported within 60 days to the affected individuals, the Department of Health and Human Services, HHS, and the media. These requirements and consequences are part of a broader legal structure made up of 4 main Health Insurance Portability and Accountability Act rules. Privacy Rule limits use and disclosure of PHI. Security Rule requires safeguards for electronic PHI. Breach Notification Rule mandates timely reporting. Omnibus Rule extends rules to business associates. A few ways to follow the Health Insurance Portability and Accountability Act include not discussing PHI in public, using secure communication, locking files and logging off, and verifying identities before sharing protected health information. Avoid these common Health Insurance Portability and Accountability Act violations. Lost or stolen devices without proper encryption, unauthorized access of patient PHI, unsecure disposal of records, late breach notifications, talking about cases in public, sending PHI to the wrong person, sharing logins. Even small mistakes can have serious consequences.
The Health Insurance Portability and Accountability Act builds patient trust and protects everyone involved. Follow the rules, stay alert, and report any concerns. When in doubt, ask your privacy officer. Thank you for helping safeguard patient privacy. Your role matters.